We love our live Wednesdays, and we love talking to you. And we love our topic for today. And of course, when both of us are there, we love to talk about a topic we both love. You know what I love? I love toddlers. They're the most challenging kids of all time. And I feel like
I was just about to say, I love that you're making the whole Christmas noise.
Merry Christmas, everybody. And
Hi, everyone. Hello. And yes, most importantly, let's introduce ourselves. Yasmin, child and adult nutritionist at my Pediatric Clinic. And the one and only Dr. Yasmin, tooth fairy, amazing pediatric dentist.
Yes, let's introduce the topic. What are we going to talk about?
So, with picky eating, there are behavioral strategies to help you reverse the picky eating, and this is what we will discuss today.
They're easy.
Yes, they are, believe it or not. But they have to be practiced one at a time, because we don't want to, of course, overwhelm the parents, because a lot of the work is on the caregiver or the parent. All right.
And you know what else we want to say? أول حاجة يعني this time we're talking about behavioral strategies, especially for toddlers, صح? Especially for toddlers.
Exactly.
طيب, and you know, like 5-10 minutes ago, I had a mother, a picky eating boy. He's medically challenged. He has diabetes. Okay. And she just says it's difficult, it's hard, it's not going to work. You know?
It does. She actually said, which is common.
Yes.
It doesn't go to work because
she already said it.
Yeah.
I tried, and then she was like, no, don't even tell me. It's hard, it's difficult, it's not going to work. Which is why our number one thing is
to reassure the parents that it can and it will work.
And it will.
and we're here to help.
Yes.
And
with
please
the right information.
feel free to ask your questions بالعربي or in English or in Arabic.
Yes.
We are here to answer.
We love your questions. Please don't forget to keep them coming.
So to start with picky eating, it is developmentally normal to go through this phase. Children go through it. This is instinct. But how we approach this phase between age usually 1, 2, 3 or 4 is the key, because you don't want it to become a lifelong struggle for the child or the parents as well.
You know what? You're bringing such a good point. So the first thing we said is they have to believe it's going to work. And the second thing is, you know, a lot of people tell me, you know what, when he's older, I can negotiate with him, then I will try. And I say, What picky eater? Always picky eater.
Yes, and I
picky
also
eater
see adult picky
eaters. I know.
It's very hard to change habits at an older
age.
age.
Hey شيمو, we love you. كل عام وانتم بخير.
وانتم بخير.
مشرفينا ومونسنا. ما تنسوش يعني تسألونا أو what is your experience دكتور شيمو مع picky eaters؟ تعمل لهم ايه؟ ورسيم thank you so much. كل عام وانت بألف صحة وسلامة. ما تنسيش تسألينا أسئلتك الحلوة. Nice hats, yeah. We're all Christmassy and we're cute.
So we'll start maybe from a nutritionist point of view.
Yes.
When it comes to picky eating, as we said earlier, it's very important to understand that this can be resolved. And it's not, it will require some patience, but the sooner you start, the easier and the better it is. And if gone unresolved, and believe that later on he will be better, this may cause a lot of issues, especially if the child is omitting important food groups. So malnutrition can take place, dental cavities can take place, digestive issues can take place, and the list can go on, and even overweight, underweight can happen, because people think, it's picky eaters are just, they become underweight, but no, they can also be overweight children and have health issues if they are always opting for a specific food group and processed food and so on.
But I want to add something. But the other day I got a patient. She is 2, and they are only giving her, guess what? In a bottle.
Oh, milk.
But more importantly,
formula.
Pediasure.
Oh, I see.
And they're like, خلاص, she's taking her vitamins from it, so we're not too worried. But I'm like, أول حاجة she has 20 out of 20 cavities.
Oh, I'm so
and this
happy
is
you
why,
brought it up, by the way.
Yeah, and this is why both of us are talking about the topic, right? Because it affects us both. So now I said, okay, she is having Pediasure in a bottle. That's great, but her vitamins, do they come from natural sources? What do you have to say about that, especially for a parent that thinks, oh, Pediasure is enough. No need for vegetables, no need for fruit, and we shouldn't do any effort for that.
Very interesting, and I will elaborate on that. Just before, someone is asking when عيادتكم؟
وين عيادتكم؟
بمدينة دبي الطبية, Dubai Healthcare City, Razi Building, and you can check my Pedia Clinic page to get more information about my Pedia Clinic. And to answer, yes, so basically, when it comes to Pediasure, we use it only in specific cases if the child has malnutrition after having done evaluation, medical and nutrition assessment. And this is usually the last resort because we don't want, of course, it's a supplemental to a balanced diet. It's not a replacement to a balanced diet and behavioral changes. And this is why the key here is to make changes to the habits, and one step at a time, and get creative with the recipes and be a role model as a parent. So if the parents are picky eaters, it's more likely that the child is also a picky eater because he's not exposed or she is not exposed to this habit of trying new foods and so on. This is why be a role model, get creative, involve your child in preparations, and even one very important point here. So we have questions here. Should we? I need to bring my son to your clinic as he is.
Welcome. We love to have you.
Why
don't you send us a private message? I'll answer that privately, sir. وبصي, Dr. Shima is talking. Dr. Shima is a pediatric dentist from DHA. She's amazing. She's a good friend of Dr. Mustafa and myself.
Oh, hello. Nice to meet you.
And she's saying picky eating in kids is normal. Personally, I use different ways with my kids. Oh, nice. You can try positive reinforcement if they finish their dish, and always start with the small amounts and don't push. Perfect. Yes, role model is so crucial.
I like that you mentioned don't push. Yes, it's important to listen.
They sense it.
They get that anxiety, and this is why it's important to listen to their hunger and fullness cues, and plan their meals. Plan their meal timing, give them a nice schedule because to get the child hungry to eat by giving them so many snacks during the day. Not only you are increasing the dental cavities, but you're also getting them to reinforcing or pushing for picky eating. So meal timing, plan the meals, respect your child's appetite, and set a good example that we mentioned, and don't be afraid to explore and use reinforcing and positive words instead of hindering phrases like please eat for me, try for me, if you don't eat I will be upset,
and if you eat I will give you candy.
Exactly. Positive reinforcement.
Let's not do that.
Exactly. Positive reinforcement we're using rewards such as food is not recommended because you are creating also person with eating disorders for later on in life.
But positive reinforcement with a sticker. What do you think of a sticker and a chart?
Yes,
or food stickers, you know.
Exactly. So there are so many ways to positively reinforce. Through like activities, through stickers, through like fun, reading a book, getting a story, even
quality time,
100%. And most importantly, make it fun. Toddlers, especially toddlers, love the entertainment, the fun, and avoid using screen. I'm noticing it every day. More and more people opt for screens. It makes their life easier, but believe me, it is.
I have a question for you, Yasmin. And lots of parents ask me. So now, my child today, you put something, and they didn't eat any of it, but the next day. But today, for example, you put broccoli, you put a carrot, they didn't eat any of it. Should they be worried? Or you think kids in general, over a week, especially that kids' perceptions, hey lovely, we love you. Kids' perceptions and kids, what's the word? kids' appetite and kids' normal ability to take food is on a balanced week schedule. So maybe today they didn't want it, but their body needs it. In a few days they're gonna have it. What do you think about that?
So if they don't eat it today, they might eat it another year.
Yeah.
Okay, that's very good. I'm happy you brought up, because do not stop trying.
Yes.
Sometimes it takes one time trial, sometimes it takes 10 times before the child eats it. So exposure, and always expose them to one.
Exposure and familiarity.
Exactly.
Absolutely. Kids eat with their eyes too.
Because there is that fear. Again, as we said, it's part of development of trying new food, because so that they don't pick up things they don't know from the floor to eat. So it's instinct, and this is why picky eating is a normal part of development. So what we can do is approach them the right way, and exactly as Dr. Shaima said, link it to something that they like, to a character, or explain to them how.
Hair like Rapunzel,
masalan, and getting them to get excited, like sprinkling some magic into your food. Like they like the act of dipping, they like the act of like creating a funny face using like vegetables and fruits, creating a Christmas tree now that it's Christmas. And there's so much you can do. It's just that it does require some effort and some time, but do not give up. My advice to you, do not give up. Keep trying, and of course we are here to help and answer your questions, of course.
Lamo Life, don't forget, send me a DM, direct message. I will answer that question directly, because we have different consultation rates. And I'll ask you which doctor you want. Okay? Bless you. Thank you for asking that question.
Thank you.
I love Dr. Shima's positive reinforcement. Can be an outing, a gift, or doing their favorite activity. And I love that. Kids understand quality time. Kids currency. Now, unfortunately, a lot of our kids now, they want something materialistic, But kids still understand the quality time. You want to spend time with them.
Yes, so sitting at the now that the holidays are here, people have more time to spend with family. Take advantage of this and eat together as a family. Absolutely. This will also reduce the picky eating. Absolutely. And let them be, let them touch, let them feel, let them describe the food. So it's not, there are so many ways to get them to, fear less new foods.
What do you think about the strategy? If you don't like it, just lick it.
Yes, exactly.
I love it.
Just lick it, or even if you don't like it, spit it. So at least the child, there's no stress of like, oh, I have to swallow it, or I have to get it into my body, because they do fear that. And so by telling them, try, and if you don't like it, spit it, that's one way also of doing it.
Dr. Shimo, we love Dr. Shimo. She says, make sure you do not lie and not break a promise no matter what. Yes, absolutely. Yes. Kids' trust can go like that, right?
And I'm happy you brought it up, because why? A lot of people, they tend to hide.
Hide the zucchini.
Yes, hide the zucchini into
hide the bell peppers, hide the broccoli, hide the yucky stuff.
Yes, so by hiding, you are leading them not to trust you, and this will aggravate the fear of new foods. So have them, help you preparing the smoothie, let's say. So, we're going to put that, it's going to look green, just like the Hulk, and we're gonna do we're gonna have superpowers, and let's prepare this and do that. And so there are ways, there are recipes to get them to like also certain foods. And what else can
I had something, but I completely
and
forgot
also
it
I
now.
mean then again some children have issues with chewing the food, or maybe pain in their gums or their teeth,
or
so it's important to rule out any
or decay. It's so simple. It can be just decay
100%.
or a pocket, organ pocket. It is. So we always have to look for physiological reasons first. And look, the strategies, we just have to believe they're there and put 1, 2, 3, 4 strategies and use them. And keep using them even if they don't work. Just like you said, put a small little baby broccoli every day. Just for them to see it and get used to it.
You can
What is that called?
You can sing a song about broccoli. You
I
can
like that.
read a book about broccoli.
But what is the name of the fear of new food?
So
Because it's a real thing, isn't it?
Yes, it is. Since some children, it may take time to neophobia. Neophobia. So phobia
It's
is
very
fear,
interesting.
and neo is new food.
Aww.
And this is why feeding picky eaters can be challenging, but do not give up. It's important that you keep trying different strategies, stay calm, because when force feeding also may backfire as well. And you will be surprised. You will be surprised. One day they'll just start like, and I had like a patient. So if you want to give examples,
I love stories.
her 3-year-old, she did not like salmon or any seafood whatsoever. And one day her mom started like eating salmon in front, so she prepared the plate for her and they sat next to each other, and the mom was enjoying her meal, her salmon dish, and the child looked at her mom and was like, "Mommy, I want this, can I?" And she ate her whole plate, the mother's plate, which was salmon and veggies and all that. So leading by example again.
So good.
Yes.
It's so good. I love it. Yasmin, we're about to wrap up for the day. Do we have any last
questions?
last recommendations?
Recommendations. Okay. So my recommendation to you is Merry Christmas and Happy New Year.
Merry Christmas and Happy New Year.
And,
all the best.
And enjoy. Go out with the children. Us feel free.
Okay, we love you and have a beautiful year. I think this was the last one of the year, isn't it?
Yes,
it's the last one of the year.
Bye-bye.
Have a beautiful year, inshallah, from my media clinic.
Inshallah. Bye.